low weight plate. Again, you could use a medicine ball. You could use a med ball anywhere from sort of 2 kilos upward. A little mini squishy Pilates ball. Like I said, ideal world, a little bit of load so that it starts to challenge your ability to be able to stabilize the pelvis whilst you're in this isolated lunge hold or an isometric lunge hold. So the rear knee when you're in the lunge is off the ground, and essentially what we're doing is we're bringing into play some side to side flexion within the torso and the ribs whilst you've got the weight overhead, and you've got to be able to control your pelvic perturbation or movement. So there will be a small amount of movement going on around the pelvis, which is completely normal with given the load that we're going to be using. So here goes. So I'll show you side on to begin with. So we're going to step into that isolated lunge. One leg forward, one leg at the rear, and I'm up, if you notice, I'm up on the toes. I'll step away a little. I'm up on the toes on the rear leg. So the rear leg isn't flat. We're up onto the toes. We're going to drop the knees down as far as you feel comfortable, but ideally keep the knee off the ground. We're going to go with a plate overhead, and then what we're going to start to work from there is just a real small shift, right and left, so that you can feel that challenge going on around the legs, through the pelvis, and obviously we're getting the torso involved with that side flexion. So front on, here we go again. So we've got one leg forward, one leg back. We're going to drop down into the lunge. And we go with a plate overhead. And here we go. So try and breathe with the movement. You can slow it down if you want to.